This year was different. This year was very different. So early on in this pandemic, we realized that it was a safety issue and that we could not take students to DC. So with much disappointment, we decided that we had to cancel the fly-in. But with a great deal of optimism and trepidation, I emailed each of our speakers and I asked if they would consider joining us for a virtual fly-in this year. And they enthusiastically responded that yes, they would be happy to do that. So we rolled this out. We rolled out this virtual fly-in after creating a modified agenda and really trying to make this work virtually in a virtual space. My hats are off to our field team who helped me figure out how to do 4 different breakout rooms for the 4 different bill groups, and our professors who joined so many of our professors joined with our field team and me to help give the students feedback on their advocacy pieces and work with them through the process. The speakers were wonderful. As I said, the presidents of CSWE, NASW, Commissioner Jerry Milner in Health and Human Services joined us, and a myriad of policy and advocacy experts to help us pull this virtual fly-in off in 2020 this year. We also had alumni. Coy Stout with Gilead Sciences, which as you know has been in the news of late with remdesivir, was so kind to give his time and share his experience with our students, as well as Claire Anderson, also an MSWDC alumna, who is with the University of Chicago Chapin Hall as a policy fellow. They gave their wisdom and inspired the students as to what their social work career could be.
Together at the same time that we are focusing on preventing unnecessary foster care placements and strengthening families, we also have to focus on doing what we do from an intervention standpoint as well as we possibly can.
About ethical principles of research so that we're not just going into communities to answer kind of obscure research questions, but are they questions that are of importance to the members of that community? Can we provide information about what we learn so they can improve their community? Can they be part of the solution and not just research subjects?
It's a broad investment in our profession. 2 quick things to mention. Telehealth, which is a key component of access to mental health care, has been largely enabled through the COVID crisis. We want to hold on to these gains. So this is very successful progress that we're seeing during this crisis.
There's a whole global community of people who are behind you. So whether you're a student or a researcher or an educator or a practitioner or someone who's doing macro social work and you're doing advocacy work, but there's always a large number of social workers who stand with you and behind you. And as we think about, 700,000 social workers in this country, we're never alone and we can always pull on and call on each other.
So the virtual fly-in was 2.5 days this year, and the students ended on a very high note. What we've found over the years, and it was no different this year with the virtual fly-in, is that if students can advocate on a federal level, they can advocate on any level, which is what we want to teach them. Because the most important advocacy for social workers is advocating for our clients. So wherever you are, I hope this finds you well. What I know for sure is you're doing good things during this quarantine period because you're social workers and you're friends and supporters of social workers. So as I say to my students, go forth, do good, and roll tide.